All right, we're going to get started with our next session, and I can't think of a more straightforward title than Technology Solutions for Better Outcomes, linking the two. And to lead our panel today, I'm very happy to introduce Dr. Alan Lotvin, who's the Chief Transformation Officer for CVS. Alan, let me hand over to you.
Thank you very much, John, and it's really an honor to be here with this incredible panel. And I thought what we would do is I'll give you just a 30-second overview of what my job really is. I usually make the joke is it's whatever I can convince my boss to let me do, and I'm a good sales guy. So, and then we'll talk a little bit about technology and sort of my thoughts about it, and then we'll turn it over to the panel, and we'll get started. So, first, in this country right now, if you have an acute event, and this is kind of what I'm trying to do, whether it's a heart attack, you break a leg, get in a car accident, you're going to have a good outcome. It's going to cost too much, but you're going to have a good outcome. And not only that, the outcomes have been getting better and better and better over time. Now, you can contrast that with chronic disease. If you develop a chronic disease in this country, I can't say the outcomes are getting better and better. In fact, the incidence of chronic disease is going up, and you have to say, as a healthcare system, we've actually done fairly poorly. And so what my role is right now, and the way I think about it, is how do we take this, and I'm a cardiologist by training, so if I pick on doctors a little bit, please humor me, this provider-focused system and turn it into a healthcare system that's organized around and for the benefit of consumers, largely to treat chronic disease better, because that's where the unmet need is, that's where the burden of care is. And we think we can help do that by bringing more services into people's communities. And I define community as in the home, in the palm of their hand digitally, as well as in kind of retail settings. So that's kind of my job. And everyone on this panel is either a partner of ours or soon to be partner of ours. And so that's that. So let me just talk a little bit about technology and healthcare and high-tech notes. There's this thing about healthcare and technology, and part of the trope that's gone on for a long time is that healthcare is terrible at using technology. And that's not true. So if you go back and look at things like MRIs, which we all take for granted, I'm old enough to remember when MRIs and CT scanners first came about, and you could actually look inside a body without cutting it open. That was pretty amazing technology. If you think about what some of the pharmaceutical industry has done with what's called CAR T therapy, where we take white cells out of your body, we sensitize them to your tumor, grow them, and then inject them back into like little guided missiles to kill that tumor, that is as close to science fiction as I can imagine. So we're really good at that sort of technology on the professional side. The flip of that is if you go into your average doctor's office, there's more technology in a fast food restaurant, right? And so there's this dichotomy on the professional side. And I think it's important to think about how healthcare professionals use technology as we think about consumers, because we want to have a closed ecosystem. We want to have an ecosystem where all of the great information and data that we're creating with these things ultimately gets back to the docs and into the healthcare professionals' hands to be used for care. So if we think about consumers for a second, there's a real gap in healthcare right now. And the gap goes something like this. If I asked you to look something up, you would undoubtedly go, or most likely would go to Google. If I wanted to get a car, we would call Uber. If we wanted to watch a movie, we'd probably go to Netflix. There's no equivalent in health. It's just not. And so when I think about those companies, and everyone wants to get there, that's why there's this flood of VC and private equity money into healthcare. So everyone wants to get there because of the exponential growth that we see in these organizations. And Peter Diamandis had a great description of this exponential growth. It's got really four things to start. One is digitization. So data gets digitized. Well, we're there in healthcare, right? We have electronic health records. They're used ubiquitously, if reluctantly. We have all the claims data, all the lab data. We're getting more and more wearable data. So we're on the digitization, check that. The second thing he says is dematerialization, meaning stuff just disappears. So film disappeared in favor of digital pictures, as an example. Now the problem with dematerialization in healthcare is most of the cost and expense is humans and hospitals. They're not going to go so quietly into the night. When things dematerialize and now become software-based, they demonetize. It's a lot cheaper to create bits and bytes than it is to create atoms and molecules. And when you have the dematerialization and demonetization, you get what he calls democratization, which is you have instant access to 1 billion customers or more. And if you think about it, to have 1 billion customers, 30 years ago, you had to be Coke, right? Be in 110 countries, it's enormous infrastructure. WhatsApp built 1 billion customers in 18 months. So how do we get there in healthcare? Why doesn't that exist? And when I have this conversation with people, I usually get answers, and we're going to talk about it on the panel, so this is a quiz, right? I get answers like, well, it's HIPAA, there's all these rules, there's all these regulations, there's, the corporate practice of medicine, it goes on and on and on and on and on. What I'm going to tell you is I don't think any of that's true. I think the reason we haven't gotten there in healthcare is we haven't given people a reason. Because if we give people a reason to want something, anything can happen. And as an example, I'll sort of just tell you a very fast story, and then I'm going to stop and we'll go to the panel. When I was a kid, or even when I first had kids, the first thing we told them in 2000, my daughters are 20 and 17, so first thing we told them was never get in a car with a stranger. Don't ever do that. It's crazy. Right? My wife and my older daughter goes to Berkeley, it's a little bit of counterculture. She refuses to carry an iPhone. She has a little flip phone. And my wife and her had a fight about not having an iPhone so she could call Uber to get in a car with a stranger, right? So in 10 years, we went from don't ever do that to I can't believe you won't do that. It was a little bit loud, sorry about that. So my point is that if a cultural norm like that can change, little things like laws and regulation can change. So it's really up to us to build the products that consumers really want, and the rest of it will take care of itself. So with that, I'm going to turn it over to our panel, and part of our topic will be building those products, but I'm going to ask everyone to maybe take 30 seconds to a minute, introduce yourself, what you do, and then how you're thinking about consumer technology and healthcare outcomes.
Thanks, Alan. So my name is Amy Foley. I run the product innovation and delivery team at Johnson & Johnson, which is the world's largest healthcare company. And I think that the great part about being able to sort of evangelize what J&J does in the world is we're really trying to be there from the beginning to the end of people's lives in consumer products, in medical devices, in pharmaceuticals. And so our role on the product innovation and delivery team is to really look for those opportunities to improve total health, right? And we have a lot of insights based on the different areas. And so when we look back at what can we do for consumers and individuals? People are patients at different times in their lives, they're caregivers at different times in their lives, and they're consumers all the time. And how do you bring all of that together and look at it very differently than looking at it in a single sort of aperture?
Great. I'm Nicola Kamath. I run product marketing at Ginger, which is exactly what it sounds like. I take products and services to market, and I also oversee our member engagement. Ginger offers an on-demand mental health system, an actual provider of care. And what is that, you ask? Within seconds, someone downloads an app, and they can start chatting with a behavioral health coach 24/7. If they need additional care, we can bring in therapists and psychiatrists into the care team via video sessions. So we have this complete mental health experience. So that's a little bit about what we do. How I view technology as needed in the industry and how we use it at Ginger are pretty similar. Core to our technology is delivering high-quality care at scale. So we use AI across the population to really superpower our coaches and our clinicians, offering them workflow automations, escalation risks, but also giving insight in what's driving high-quality care. And if I think about where there's big opportunity in industry for technology to really move health outcomes forward, it's on that measurement-based care. Just finishing up on how Ginger uses technology, we also use it to fuel collaboration between providers. So we have some collaboration features, and of course, power our on-demand app experience.
Great. Good morning, everyone. I'm Vivian Lee. I am an MR radiologist, so thanks for the shout out to MRI technology. I have been in academic medicine actually my whole life. I was the chief scientific officer at NYU, and then most recently was the CEO of the University of Utah's health system and the dean of the medical school there. I made the decision to move into tech very much along the lines of, I think, the question that you're asking, which is what is the future of healthcare, and how can this group of people, and many of you, I'm sure, in the room, really start to change the direction of healthcare in the US and around the world. So I lead Verily Health Platforms. I'm just curious, how many of you have heard of Verily? Oh, that's pretty good. So for those of you who haven't, Verily was originally part of Google X. It was purpose-built spin-out company from Alphabet. When Google became Alphabet, Verily first started as Google Life Sciences and then was rebranded. It's purpose-built for life sciences and then more recently healthcare. So I joined about 20 months ago to lead the healthcare piece, and what we're really focused on is how do we leverage the various capabilities across an Alphabet company that include hardware and medical devices, new sensors, to generate new kinds of data and new insights about people. How do we combine that with data, analytics, AI, machine learning capabilities that, of course, are very deep in our organization? And then finally, I think what's most magical to me as a physician who has spent my whole life telling people stop smoking, exercise more, is this tremendous understanding about consumer or just human behavior and behavior change, because I think that's really the biggest challenge that we face. Not only how do we change our own behaviors as people and patients and consumers, but also changing the behavior of people who are deeply entrenched in healthcare in the status quo, who may want to change but may not exactly be in a situation where they're most prepared to succeed in that change. So our organization is very focused on quite a wide suite of efforts in patient, family, caregiver products, in healthcare, clinician products, and then in population health level. And so we're focused on kind of how do we support that whole change across the ecosystem.
I'm Jennifer Schneider, and I am an internist and a health services researcher, and I currently serve as the president of Livongo Health. My job at Livongo, I oversee our product, our data science, our engineering, our marketing, our growth, and our clinical teams. So kind of the meat and the nuts and bolt, the guts of the company, if you will. Livongo Health is on a mission to empower people with chronic conditions to live better and healthier lives. And we're doing that by making the bet on the individual person living with the chronic condition. So as Alan talked about earlier, the healthcare ecosystem does really great for acute healthcare problems, babies, broken limbs, car crashes, heart attacks. But for those, and I live with type 1 diabetes since I was 12, so I have seen the evolution of products over space and over time. For those of us living with chronic conditions, the ecosystem in healthcare has not truly been built either from a technology standpoint, that's increasing and improving over time, but truly from an information and an ability to encourage and sustain behavior changes, which is what it takes if you have a chronic condition, to decide to sleep, to exercise. Every day you're making hundreds of thousands of choices around how you're spending your time, and that's really influencing your health. So Livongo Health, we have products for diabetes, for hypertension, for diabetes prevention, so to prevent diabetes, and for behavioral health, for anxiety, depression, and the like.
Great. So obviously a very broad set of experiences, but I think organized a lot around how do we use technology, how do we use AI to change the world. So I'll start with AI as kind of the question for the panel, and everyone sort of mentioned machine learning or artificial intelligence in one way, shape, or form. So maybe Vivian, can start with you and just talk a little bit about where do you see I think the promise is clear, but where do you see the barriers? Like, what are the biggest challenges that you're finding? And then maybe, Jenny, you can follow up in terms of actually getting people to accept this sort of approach.
That's a really complicated question. I think maybe it might be easier to start with saying, I think, in my view, we're still in the very early phases of the public and those of us in the industry really understanding the full potential of AI and recognizing what that is. I think when people AI, the idea of AI using big data to do basically regressions or statistical sort of pattern recognition has been around for a long time, but how it's actually applied to improve health, we're really only in the very beginning days. So when we, some of the examples that we talk about for AI, for example, we have a product which is actually very similar to Livongo. It's called Onduo, and it is a diabetes management prevention. It's actually almost a very, very similar product. But one of the features is that instead of keeping a food log, you actually take pictures of your meals and snacks, and we use Google's AI algorithms to automatically recognize the food. It's fun, it's actually a point of engagement, it's helpful to some degree because we do use we tie that a little bit into recommendations about meals, but it's mostly from a physician's perspective, it's mostly about engagement. People find it fun, they go into a new restaurant, they take a picture of some new dish that they're trying, it recognizes it, and then they text their friends or they social media it. That's an example of AI in healthcare. It's kind of unexpected, and it's used for a purpose that might not be what we expect. All the way to the spectrum of AI in imaging, for example, using AI to spot tumors on a lung CAT scan, for example, or using AI to automatically interpret images from a patient with diabetes to look at the retina, to look for retinopathy. That kind of AI enables access to care to people who are really not able to get that care.
From the profession, from the ophthalmologist or from the radiologist?
Yeah, I think AI, just like data, just like electronic data, it will be, if it's not already, ubiquitous. So it can be used for good, it can create controversy, it can be problematic because it causes change, like everything. So I'm a radiologist. If you go to the radiology sessions at the annual meetings, on AI, there's enormous amount of fear and paranoia that it's going to completely displace the profession. Those who are a little bit more forward-thinking think, this is going to make me such a better radiologist, and this is going to enable me to focus on the really challenging, difficult cases, and also this is going to get imaging to the third world and underserved parts of this country that desperately need it. So it's like all tools. It can be used for good, it can be used for bad, but I think most importantly is our ability to narrate and to communicate what those benefits are so that people aren't scared because there's some kind of a spooky magic to it. It's just a tool, it's just a technology. It's a matter of how we use it and can we use it in a way that's really productive.
So Jenny or Nicola, you guys both have lots of patients who are experiencing some form of machine learning on a daily basis. You want to chat about what your experiences have been?
Sure, I'll start. So we call the platform that underlays our whole suite of conditions AI, and it's a pun. It's in trying to be a little bit funny, but it's actually calling out the 4 key pillars of AI and goes to your first question, which is why has AI not transformed healthcare the way it has other experiences? So for us, first A is aggregate, the I is interpret, the second A is apply, and then iterate. And I think where AI has historically underserved in healthcare is actually applying back into users' life cycle and users' workflow so that we're getting the good out of what's happening. So an example, with our partnership with CVS, if you are, as a covered entity, you're eligible for Livongo platform and you're at the checkout counter at a CVS store and you're buying a blood glucose, the individual person can actually say, hey, you're eligible for Livongo. We're meeting our members exactly where they are. Today we announced a partnership with Higgy. Again, there's once every second, somebody in the United States is going into one of the Higgy machines. They're these on-station sites where you can do blood pressure monitoring and some biometric screening. And we have the ability now to identify those people and invite them into the Livongo system. The reason I bring that up is because I do think that the algorithms, the fanciness around kind of what the prediction, what action you should take is really important, but it's delivering that message to the user where they are, not asking them to deviate, and giving it to them in the words that really matter to them. We do experimentation on our platform that says you can ask somebody to check their blood glucose in the morning. You actually have to ask men over the age of 60 in the Southeast. You have to use different words than women in the Pac Northwest, right? The soccer moms versus the retirees down in Florida. You use the same knowledge that's generated by AI, different messaging, and when we deliver that hyper-personalized message, we see 40% sustained behavior changes. So I think that one of the key components for AI is not just the algorithm, it's fitting back into the workflow for people.
Nicole, how have you guys done?
So our perspective on AI is interesting in mental health, because mental health is a space where it's been black box. We can talk about how meaningful use kind of skipped over the industry. We haven't had a lot of data measurement there. So if you can introduce a virtual system where we can actually measure across the population, we can really empower providers to personalize care. guide care, and then make effective decisions on quality, on things, and understand what's driving outcomes. So practically put, how we've seen it help our system is we can understand and predict when is demand going to be. When do people need help with anxiety? When are they going to come into our system? We've seen 76% of people come into our system and have interacted with a coach outside of business hours. And we know, and we can help that to better serve their need, as well as understand, hey, what's working when they're interacting with a piece of content within our app. Are they sticking with it? Are they completing it? And we can feed that information back to the provider where they didn't have visibility into it before. And so we really use it to kind of superpower them and help them work off a data set that just wasn't possible. And we believe that can help really personalize as well as guide and drive accountability in care.
So I just want to pick up on that for a second, because mental health is a really interesting, right? Everyone I talk to, like if it's not one of the top 2 or 3 concerns from benefit managers, how are there opportunities to use technologies differently to help identify people who may be having behavioral issues or behavioral health issues that they don't even necessarily know about? Because who knows what's normal? I don't know what I will share my thoughts later on, but sometimes they seem pretty abnormal to me. But how do I figure that out, and how are you guys doing that?
Yeah, you know, that's actually a really interesting point. Even folks that come into our system actually don't know exactly what their issue is. It's a large reason why you enter our system and you're immediately talking to a coach rather than going through some extensive screener, because that person is able to pick out nuance, and then you have the AI on the back end analyzing that chat and understanding, hey, here are flags, here are patterns, here are connections, and matching that across a population because you have the whole data. And that's powerful in an industry where you need the humans to deliver it, and there will always be a lot of the services component to healthcare, but the technology can really supercharge it.
So that's a good transition to my friend Amy, who you've known for a while. So
I was going to get away with it.
No, you're at J&J, and J&J, if nothing else, has really has I know the credo and has one of the best stories of earning consumer trust of all time with Tylenol way back when. So as you think about, so I'm going to assume this is a conversation you've had internally. If not, yeah, you got to answer the question anyway. How do you think about balancing kind of technology innovation, the deep understanding of people you can have through AI without violating the trust of the consumer and going past the permission you think you have?
Sure. So I think it's complicated, right? If it were easy, it would all be done and everybody would have a recipe. I think there's a lot of things that we just discussed on the panel that are important, right? So there's the sort of fundamentals of permissions and making sure, you know, people are granting you the access that you need, that they have the chance to opt out of that access and all of that kind of stuff, right? That falls into that category of just fundamentally being, you know, what we would call a credo-based company, what anyone would call, you know, delivering with integrity in the system. So those are fundamentals. I think that the challenge comes into what you were just talking about, quite frankly, is people don't show up and say, I have this problem. Sometimes they do, and sometimes they do have that problem. Sometimes they do and they don't have that problem, right? And so if you think about barriers and why people don't take medications, it's not always the reason that they're saying, right? Well, you know that. So I think when AI is helping people live into what they're trying to accomplish, and we see a lot of mission and purpose-based information tying to how we use the data that we get back from these pieces, right? So if all of a sudden I know something completely random about you, you may come back and say, how do you know that? Are you violating something? I never told you where I lived, or whatever the case may be. But if you're giving us some information and we're building off of that information and we're putting it together with things that are solving the problem, we definitely see a much better receptivity. And so something as basic and non-technical as understanding why somebody wants to be well, understanding somebody's motivation for surgery, understanding why people want to lose weight and the societal kind of norms around that are really, really critical. And people are willing to give that permission more extensively when they see value in what you're delivering. And so while we have to do what everybody else needs to do about respecting people's boundaries and making sure we have those permissions, we also try to tie that very, very clearly to the benefit that the individual will see in return, right? Which is what we all want and need. We don't want to just give out data. And to use age-old examples, you couldn't get anybody to give a social security number 20 years ago, and now, we'll
look it up on the web.
Exactly. So we'll give anything to anybody as long as they get us, wherever we need to be.
Right.
So, but you have to have a reason for that. So.
And to just tie that to what Jenny said, I think about the ability to really make it personal, which I think was her point, that you can really engage them by making it a personal interaction, both in terms of their own biology and health conditions, but also the way in which they're going to respond, sort of knowing the right language, I think that makes it even more meaningful, that it feels like it's for me, it's not a one-size-fits-all.
I think one of the things that, and we've only owned Aetna for a year, so I can still talk about it in the third person, but one of the most impressive things or groups that we uncovered within the Aetna team was they brought in a really experienced group of consumer behavioral data scientists. So they really sort of went about saying, how do I influence health behaviors as if I was trying to get someone to buy something differently? And they really take a very, very different approach to the world. I mean, they run up against all the barriers of regulatory that you'd expect, but it's been fascinating to work with them and see how a different set of eyes, using a similar set of tools that everyone had available, has come up with some very, very different results. They've increased the rate of people, for example, getting flu shots, something pretty simple. They tripled it. Well, that's a pretty impressive number. So I'm going to go in a little bit of a different direction now, and these are the hardest. This next little exercise is hard because we're going to start with Jenny, and I'll go last. That's the hardest. Okay. And so the question is really going to be is what do you see, right? And technology writ large. You can choose AI, you can choose wearables, you can choose whatever technology you want. But what's one barrier to technology that you think we need to think about as an industry to overcome in order to use technology to improve outcomes? And so you and I are going to go last, so it's going to be almost impossible. But
yeah. I see how you think of it as a different route from our last, but I think it's actually fairly similar, which is the outcomes are, in healthcare, unless it's acute, are behavioral changes, behavioral modification we just talked about. In order to do that, you have to have trust, so there has to be a give for the get. Right, so you get data, and what's the give? What are you giving back to that individual? Not just to change their behavior, but to build that trust. So in healthcare, chronic condition management, when I was 12, I was diagnosed with type 1 diabetes. I would write blood glucose values in a log, and 4 months later, I'd go see my doc, and he'd look back 2 months ago on a Tuesday morning and say, what happened? The first time that happened, I was like, okay, this is not helpful. So the next time I went, I didn't record any of my blood glucose. I just made them up as I was walking into the office, right? Because it clearly didn't matter, right? So my point of saying that is technology, I think the ability to have connected technology where there's direct messaging back to people in healthcare, so you're getting something for the get. If it's about data and data collection, you have to then nearly instantaneously give something back to that individual to encourage or have the ability to build the trust to then develop the channels to change behavior.
Okay, Vivian?
So I feel like I'm going to come at it a little bit from a kind of a macro level of the economic situation in terms of how are we actually going to ensure that these technologies are paid for. I feel like the evolution of these new capabilities are running head on into some of the chaotic payment models in our U.S. system in terms of fee-for-service versus really paying for better outcomes and lower costs of care. I think all of us believe that these technologies should enable better access, improved outcomes, and lower costs. Hopefully, we are actually generating the evidence that actually that confirms that that's true. And if it is true, then payers really need to be paying for this and making it accessible to everyone. I think that's a huge barrier for us now.
Okay, so we have behavioral change from individuals. We have payment models, both real barriers. Nicola?
Interoperability. Like we've got to have standards that allow us to share data securely, but also across populations. You know, in mental health, we're all about bridging the mental and the physical. I mean, part of the reason we at Ginger did an integrated system where we have coaches, therapists, and psychiatrists together is because we felt without it, and without that collaboration between providers, we weren't able to offer complete care. So as I think about, hey, what's a barrier to technology actually making an impact on health outcomes? It's how well can we connect it to the broader understanding and have a whole person complete picture of care. And that gets to some of the factors that Vivian was mentioning about like adoption within the ecosystem and really supporting innovation.
Okay. Behavior change, payment, interoperability.
Sure, so I'm going to go with the my personal favorite, which is just overall user experience. So also very tied to everything that was mentioned up here. But somehow I think when we are in healthcare, and I've been in healthcare a long time as well, we think that people should just accept that things are, 14-step processes, and it's your health, of course. You must, go through these steps, and that's where we get into, the conversations about regulations, and it has to be this way and it has to be that way. And I think the example you gave before about Aetna, how do you look at this from a consumer's perspective? If you go, downstairs or to the convention center and you walk the floors, there's all kinds of people taking different approaches, right? Some of them are solutions looking for problems to solve, but the ones who are solving real problems in a different way are likely not looking at it from, sort of a traditional healthcare institutional view. All of us as consumers know that it takes about 5 seconds for us to drop brand loyalty for somebody else, whether it's price or convenience or whatever the case may be. And so I think that we sometimes spend an inordinate amount of time because of the complexities in the healthcare system on how to make it work, how to get it approved, how to get it into the market, and then we sort of fall down a little bit on the user experience, and that really is where adoption suffers, where the interoperability doesn't happen, and all of those different components.
Those are 4 really good answers, and candidly, it was like free consulting, so I appreciate that from a product development perspective. So I'll give you trying to find the fifth, and at the risk of being a little bit, overly provocative, I actually think one of the biggest challenges we're going to have is the organizational, institutional resistance from the current care delivery systems. Because everything that we're talking about, to a greater or lesser extent, when we empower consumers, and we pay them to be empowered, and we give them the ability to manage their own data, we're putting the current system at some risk, in some way, shape, or form. It could be lower prestige, it could be lower payments, it could be, now that's the negative part of it. I think we'll see some doctors, as Vivian mentioned earlier, who will look at it as incredibly positive. These are great tools and great approaches that can be used to really improve outcomes. But I do think we're going to see there are a lot of people, it's human nature, it's not just doctors, change is scary. And they're going to look at this and say, I don't trust it, and I'll look for the problems. That was really helpful. I really thought that was a good little exercise. Next time we have to go in the other direction if we come up with another one of those. I guess, Nicole, I'll ask you this question because, again, I'm fascinated by behavioral health. And when you think about the proverbial, people talk a lot about the sick care system versus the well care system. Again, when someone has diabetes or high blood pressure or, toenail fungus, it's clear, it's obvious. How do you think about toenail fungus? Well,
it's a chronic condition.
It is a chronic condition. It takes about a year to cure. It's my favorite condition it needs to be treated, but not the most important thing. So in any case, but getting to the point of where we stop thinking about people when they're sick and thinking about maintaining wellness, it would seem to be hardest in the behavioral health space. So have you guys given some thought to this? And
yeah, I think mental health is really interesting because there hasn't been a focus on prevention historically in industry, and that's because we struggle for access for folks that are actually severe and need urgent help. You have to wait months to get into therapists and psychiatrists. So I think where we've seen really interesting progress and really interesting shift in being able to get prevention is one, access when people need it. And that's a lot of where technology can really intersect and help. Why is it important to have all this AI and all this data fueling higher quality care? Because it can be effective, because we can serve more people. So in order to get prevention and move more towards prevention in mental health, we think we need to open up new labor pools. So you see the AMA is now recognizing behavioral health coaching for some CPT codes, recognizing like, hey, we can bring in new labor pools for subacute care. You need to use technology to change the access points to give folks access when they need it. So we see a ton of traction with virtual care providers across the industry. And then you need to use measurement-based care and technology to really make it more efficient. So that's one kind of part on preventive care, is that fully loaded access when folks need it. And then when they do access it, it's got to be this personalized, guided care. It's got to be a journey that makes sense for their need. And it's in part the tech, but it's also about being able to understand and see what's going on and integrate with the services that, in our case, coaches, therapists, and psychiatrists are providing, so that you can tease out the nuance of what is the real patient need.
So there are, I'm going to guess there's a bunch of entrepreneurs, wannabe entrepreneurs, young businesses in the audience. There's a lot of experience on this panel. So Amy, you said something a minute ago. There's a lot of solutions looking for problems. So I'm sure a lot of people come to you. Like, what advice would you give people around how you evaluate, and we'll ask this of Vivian too, I think, how you evaluate new companies, young companies, as they come in to pitch you for partnerships, for investments? How do you think about it?
Sure. So I think it's challenging because I think there are so many things that each of you are seeing today and throughout every day that are cool, they're neat, they do things incrementally better, or they use technology in a different way. And what we try to do is really stay grounded at what are the fundamental challenges we're trying to solve, right? And so everyone, myself included, right, can get carried away with innovation and say, well, this is so innovative and so crazy. I can't believe that this thing does something that I didn't expect it to do. But if fundamentally it's not changing the care delivery, it's not improving patient health, it's not improving consumer access, whatever the case may be, we really do try to stay grounded on what those fundamentals are. And so what's really important for us, and I mentioned in the opener that with Johnson & Johnson going across such different businesses and such different aspects of individuals' lives, we really look at sort of that continuum of care of not being when people get sick, but really kind of converting that sick care into well care and looking at things proactively. And so if it doesn't solve, sort of that journey point that we're trying to solve, or that pain point, whether it be when they're well or when they get sick or when they're taking care of somebody else, then it probably doesn't fit into what we're trying to do, even though it might be a really cool piece of technology. And so sometimes that's not when we look at partners, it won't be for what the end user will see, but it might be for something that improves our supply chain into the hospital, right? Because if somebody has the right tools and the right capabilities, and that ends up reducing same-day surgery cancellations and granting higher outcomes for the individual patient because they're more satisfied with the procedure, that's very innovative. But that's something that you or I as a patient may not see. You just know that you went to the hospital, you had your surgery on time, they had the right materials, the surgeon was able to get it done. So we really do look at those pieces and try not to get captivated by all the sizzle.
So Vivian, I'm sure that within the Verily world, you guys have 1,000 new ideas a day. How do you figure out which ones to pursue and which ones to not?
Well, I think there is kind of a North Star for us, which is really about how do we make our healthcare system better. It's not about, there are so many ways in which we could use our data. For example, well, let me just start by saying what's unusual about Verily, I think, is that we are really all about partnerships. We don't run any health systems. We're not intending to acquire any medical groups. So everything we do is in partnership with others, which is interesting because every hospital that we walk into, the first thing that people ask us, they almost beg us to do is, would you please build us a new EHR? That's like request number one, to which I say, no, sorry. So we're not that interested in...
I was going to say, entrepreneurs, take note.
What we want to do is to generate better electronic data that will actually improve the health of people, for sure. But I'm not necessarily sure we're interested in shoring up certain parts of our system that I think probably need some disruption. So one of the things that's helpful for us is to have a mental model for how we think disruption should take place. And maybe going back to the issue that you raised, and also I think Nicola raised, one of our mental models is around this idea of what is the future of healthcare and how do we think about the relationship between clinicians and physicians and patients, especially in our new tech-enabled world. And that mental model is actually not a new one. There's an economist from Stanford named Victor Fuchs, who's still alive, and he wrote this paper in the 50s about the evolution across the country moving from the industrial economy to the service economy, and saying that as we move from manufacturing to more service-based businesses, that we're going to see a different relationship between consumers and the producer of those services. It's going to be much more about the co-production of services rather than manufacturing, where the manufacturers make stuff and they sort of hand it over to you. And that co-production definitely has played out. I mean, I think we see it in our lives every day, whether it's in education. You don't expect the school system only to educate your kids. You do a little bit of work at home, you join the PTA. With fire safety, you have smoke alarms. In healthcare, we really are a service industry. We're about caring for people. We have devices and technologies, but it's mostly a service. But we still think of it as the old days. We still think we somehow in healthcare, we physicians, nurses, other practitioners, we control your health. But actually, when we think about ourselves as people, we know that Jenny knew what she was eating, and what she was eating was controlling her blood sugars much more than her quarterly or however often visit to her clinician. So much more important is what happens outside the walls of the clinical system. And I think the care delivery systems that can fully embrace that and say, you know what, we recognize that we are going to be really good partners with the population to co-produce your health. And 99.9% of the time, you're outside the hospital, you're outside the clinics. We want to use the different technologies. We're going to leverage those technologies to help keep you healthy. When you come in and you need J&J surgical device, of course, you're not producing too much of that. We're going to take more responsibility. So it'll shift depending on how sick you are and how acute the care is. But if you can be comfortable with that continuum, then that enables us to do things like think about prevention, think about care in the community's mental and behavioral health in a much healthier way that isn't threatening to us.
So I'll give you my answer in 1 second, but I want to give Jenny a heads up that I'm going to ask her how Livongo kind of grew through the three stages that I'm going to sort of take about. Because the way I think of these things there are three types of companies. I see a lot of small companies, and it's really probably one of the most fun parts of my job. They fall into three big categories. So one category is incredibly clever science or technology that absolutely doesn't solve a problem that needs to be solved. But it's beautiful technology and incredibly clever. And you just sit there and go, I wish I had thought of it, but I'm glad I didn't, because you can't do anything with it. Then there's wonderful technology that solves a real problem, but there's no clear business model. And then and that's where a lot of health services falls into, right? The benefit shows up for the patient, you can't get paid enough by the patient, the insurers don't see the benefit yet, or it's too far out. There's all sorts of issues. And then there's the last one, which is kind of the sweet spot, which is wonderful technology, solving a real problem, and there's a clear business model. Livongo has done that, and as I said, it's hard to do that. So, I mean, and you're very much still in a product development, product expansion, growth mode. How are you thinking about, how do you ensure that you don't build the middle?
Yeah. So I'd say we start first and foremost with echoing the sentiment on the panel. what are we solving for? Like, are we solving for something that really matters? And are we solving pain points for the end user? So we spend a tremendous amount of time saying, for somebody with hypertension, for somebody with diabetes, for someone with mental health and behavioral health, frankly, like, what sucks? Like, what's wrong with the experience today? What can we actually do to make that experience better, improve clinical outcomes, and therefore reduce total costs? So we start with that premise, and then we say, what are the amount of costs that we could actually reduce? So if we're going to price a product or bring a product to market, we have full belief that we have to show a financial return on investment to our end customer. We need to bring something into the ecosystem that has value across the member experience, clinical improvement, and financial return on investment. That's where we start. So that's the strategy work that's done upstream, and is the market ready for that solution, right? And can we, therefore, then can we sell it? And so that's how the work that we do, and as we think about bringing things to model, that has been the process that we do for all of our different product solutions. And then healthcare ecosystem, as pointed out, is crazy. It's very complex, right? I have a lot of, I work out of the Mountain View office in Silicon Valley. I have a lot of ex-Googlers come in and have these, like, again, brilliant ideas, and they're like, we are just going to tell the insurance company that this is what they're going to do, and you're like, great, good luck with that, right?
Let me know how that works out.
Let me know how that works out, right? But this idea that then can we play and partner within the existing ecosystem? So Livongo, a newer company, a great solution, great business model, but really reliant on the pillars within the ecosystem, the CVSs of this world, the large payers, the provider systems, to integrate, to show value, to bring value to the existing players as we start to develop something new, as we have some of that disruption. Healthcare is so intertwined and interconnected that it's to come in and quote unquote blow it up as a complete disruption, I think, is not the right approach. But understanding the value that you're bringing and the partners in the ecosystem that you will benefit from the value you're bringing is really critical.
Okay, we have 7 minutes left. We are going to end on time, because that's one of my fixed rules. But this is another 5-part question, right? So we're going to go this way. No, we're going to go this way, and I'll go last, though. And the question is, we talked a lot about consumers, we've talked a lot about technology. I'm going to ask you to put on your futurist hat for a second, and look out 5 years from now. We're going to turn around and say, either technologies you saw or technologies you wish. What technology had the most impact on healthcare when we look back 5 years from now? It's easy.
You sure you want me to go first?
Yeah, you get the easy one. You only have about a minute per person, because we have to finish it on time.
Yeah, I don't know if I would commit to a technology.
This is my game, my rules. One technology, you get one card.
I want off the panel
One
now.
card draw.
So I think that whatever we complained about EHR systems before. I think whatever technology solves for bringing the data together in a way that connects the patient and the provider. And, I can't sit here and say, hey, it's going to be X, Y, Z, and I don't think I'm even supposed to.
We'll call it EHR, yeah, there's no forward-looking statements there. We'll call it EHR interoperability or data
and
interoperability.
I would say data interoperability, because I'm not ready to even commit to EHR, but I think that ability to bring that triad together with the clinical care team and the patient and the provider who potentially is at risk, I think
Perfect. Nicole?
So, interoperability is one of my favorite.
Taken. New one.
But I look at this device, it doesn't matter what platform it is or whether it's actually a smartphone or flip phone, but the idea that people feel empowered to take control of their healthcare, to be an active participant and to access it has been furthered by everything we can do in a small device, in our phones. It's connected everything. So I think if we look forward, I think we're just at the beginning of the active seat at the table that consumers are willing to take. So I think the cell phone will be that.
Vivian?
It's an impossible question, Alan. I mean, let's just, so I'm going to answer it a little just pivot, just to go a little orthogonal, which is to
So
say,
answer the question you want to answer.
I'll say now, not speaking in my role, but I'll just say as a person, the problem that I would really love people to tackle with this magical technology, if I knew what it was, I'd be off doing it, is really the issue of healthy aging. I feel like it's a global problem. I think many of us in the room have parents and others who we're thinking a lot about, and I feel like the focus is disproportionately on other populations relative to this population compared to its needs. So I guess if I were just to open up that, I hope that it will be some set of technologies we'll look back and we'll say, that was fabulous.
So I love the question. I love the question because it's hard to answer and you can't be wrong. And so when the question...
And the more extreme you are, by the way, someone will remember and say, Jenny said that 5 years ago, she's a genius.
She was brilliant. I'm going to have a job as a futurist, which I love that as a job because, again, it's really hard to be wrong. So if you look at every other industry, what has transformed other industries is flipping the table. So think about the travel agency, we thought, people can't be smart enough to book their own flights, right? You used to have to go to a travel agent, just flip the computer around. Turns out you all can do it. We can do it. We know how to do this. You talked about democratization of data. Wearables is a start, but we have not yet flipped the table where all of us as healthcare consumers have access to the data and understanding of what that data means. I sat with Joe Biden in the White House and his moonshot initiative, and he told the story about how his son Beau could not get access to his healthcare data, and how he, as the Vice President of the United States, made phone calls and could not get access to the healthcare data for his son. And so whatever technology somebody out here is going to invent, and give it a fun name, Jenny would be great to have in there, that makes the data, healthcare, all of our data available to each of us in a consumable, understandable format. And I'm talking about creatinine levels. What does that mean? Why do I care, right? I'm not talking about electronic health records. I don't think the answer lies giving information back into the existing ecosystem. I think it lies in giving all of us information to our own data so that we can then change the industry.
So I'm shocked that no one said machine learning and artificial intelligence. It seemed to be a layup, easy one for someone on this side of the panel. I'm not going to say it, though, because it's too easy. I'm going to say, I don't know whether this is true or not, but I think it's interesting. We've only started to scratch the surface of understanding what it means to have always-on biometric monitoring of hundreds of millions of people. And while we have a limited range of sensors now, I think that the first thing that's going to happen is we're going to get a whole bunch more sensor technology. And as important as history and physical are to understanding what's going on with people, I think we're going to learn from having this sort of technology, whether it's wearables, whether it's something a little bit more invasive, whether there's microneedles on your skin, a little patch, that having that on 100% of the time on hundreds of millions of people and combining it with the other data, we're going to learn so much about predicting and avoiding illness and complications. So we're going to stop there at 1:13 to go and thank everyone for their attention. Hopefully we were at least moderately entertaining. So have a wonderful afternoon. And let me thank my wonderful panel.
Thank you all. Fantastic panel. One more round of applause, please, for a great discussion. Thank you.